over 2,000 other individuals. Now, if they have a spike on something, that's more significant. I'm comparing them to 2,000 other folks. Okay, so that's what you want to look. Reliability is, well, how reliable is the test? So is it as solid as a yardstick or a rubber band? So if you want to build a table, do you want to use a rubber band as your measuring instrument? Probably not, because the more you use it, the more it's going to expand. Now so you can start here, and I just want to measure 2 inches on this rubber band. By the time I get to that back table, it's going to be 6 inches, isn't it? How it's stretching, okay. Validity. So is what you're getting a valid report of what's going on? So is a report card a valid indicator of a person's achievement? Probably more than grandma. I mean, my mother never had grandchildren who were hard-headed. She had grandchildren who were willing to stick up for themselves. She would always phrase things in such a way that if it's her grandchildren, there's really no problem. But she's seen other kids and there are major problems. So grandmas are not very valid reporters for information. And then also prediction issues. So what are the odds if this person scores A, B, and C, they'll do D, E, and F? This is the hardest thing to do, because there really isn't anything out there that suggests we can predict better than a coin toss for a lot of issues. And that's the hard part about what we do. So we have tests that have been accepted by the courts. Realistically, it's a crapshoot a lot of times. And so you're making very serious decisions using the best instruments you can, and we're getting better and better, but it's not where we really need to be yet. So there's this phenomenon, yes?
So what you're saying is, in line with what you said about environment being more of an influence than we used to think it would be. So if you're measuring it against a wider test group to see how this information really lines up, that would say that environment for that group, you can examine the environment of that group, and I guess it's likeliness that it has an effect on the person you're dealing with.
So the question is, do some of these tests take environment under thoughtfulness? Do they take the environment as an opinion or influence? When you get really good tests, what they use is U.S. demographics. They say, oh, in the United States, this is the percentage of men, women, here's the age group, and what you'll get tests to try to mimic that. We randomly assign so many women, so many men, so many people that are 50, so many But your point is well taken, that environment can't always be put into a test. So if I give you an IQ test and you're 10, and you're in this environment where you're not sure where your next meal's coming from, and then you go to so I get a test on you, a valid test. And then you go to a foster home where your needs are being met, and I give you the test again. It's likely I'm going to get different results, because the environment. But the test doesn't ever say, if the child doesn't have that, tests don't do that. They don't look at the environmental factors. But clearly, they have an influence on everything that's going on. Absolutely, yeah. So again, see, these tests are not crystal balls. I wish they were. And so the hard part is, I take my job very seriously. When the judge says, what do you think we should do? There's a lot at stake here, and so I don't want to be kind of flippant or act like I have information I don't have. I never try to go on a branch I can't really hang on. And I have had attorneys, as an example, who have asked me, can you say such and such? And I'll say, I really can't, I'm sorry. I would love to, because in my gut, I'm thinking, you're right. I don't have any evidence for it. I just can't go there. Yeah.
I guess my question has to do with if a parent is in those late teen years or early 20s and commits a violent act or something like that, how do they predetermine whether or not down the line they couldn't learn to be a better parent? Do you know what I'm trying to get at?
So, a couple things. People make the best option from the choices they see. What if one of your rules is, because you've seen this and you've been raised with this, if I get mad, I can hit you. What if that's a rule? That really means if you get mad, you're going to pop somebody. I don't have that rule. For whatever reason, I don't have it. So you can make me as mad as you want. I will not hit you. I may walk away, I may cry, I am not gonna hit you though. That's not my, so when these families, these parents are doing things, it's like, wow, where did that come from? We're not born that way. Something happened. The problem is undoing that, teaching them different things because they resolve whatever traumas they had that led them to have that rule takes time. About a year, right, to reintegrate kids in their families. These therapies take years, 5, 10 years, and you have to have a therapist that knows how to do this stuff. So as an aside, current therapists are not trained the same way I was trained. My internship at Astrom was in psychoanalytic child play therapy. Go find that now. I mean, my supervisor was a psychoanalyst. So all my training is in relationship issues and people skills and all that stuff. We have wonderful psychologists at People's Place that don't have any of that training. Because the insurance companies won't pay for it. So there's a growing gap between the level of deficits we're seeing in individuals and the people qualified to work with them. Trying to be open-minded. There are some new strategies and techniques coming out that are very effective with this group, but it's really long-term. They're really, when you're 22, if you're 22 and you're hitting somebody, and that's part of your, you're not going to resolve that in 6 months. It's just not going to happen, because some of that is there's something in you that was damaged that leads you to believe that's a rule. That's not how we raise people. That's not what human beings do. Okay? Did that answer your question?
So,
And there are tests as an example. So there's no test that predicts. So we give odds, ratios, high, medium, low, risk. I do assessments for people who have been violent or for sex offenders. So what are the odds this person is going to reoffend? You have instruments that measure what are called static factors. So we know, as an example, that white males under the age of 25 are already high risk, because most of the folks that do that are white males under 25, whether you like it or not, it is. And what's the best factor to predict reduced recidivism, reduced sexual reoffending? Age. Men 55 and older happens very rarely. So there's that gap. So when I test people, I write in my reports. The instrument I'm using is called a static instrument, meaning it went through the research and it said, if this person has these 10 issues, then there's a likelihood they're going to reoffend within the next 3 to 5 years. It doesn't even project more than that. That's how primitive these instruments are. If you're a Caucasian male at age 23, you're going to get 2 points whether you like it or not, because that's part of what the research says. That's the high-risk population. So you have to be careful when you're discussing this in court that the judge doesn't say, why didn't he get 0? He can't. He's breathing. It's not going to happen. So they're trying to develop other instruments that measure what are called dynamic factors. A dynamic factor is something we can change. So one of the dynamic factors, as an example, is they have a substance abuse problem. If the answer is yes to that, and we resolve that, that reduces the risk. That,
but if somebody commits a violent crime of some sort, and they're 20, let's say, the courts can put them in jail for 40 years. I mean, what's to say that what you did at 18 to 25 should determine everything else that happened? You know what I'm trying to get at? I don't...
next year, when you ask me back,
Yeah.
we'll talk about the sex registry problem. Because that's really what we're talking about. So a 12-year-old sexually abuses a 9-year-old, they put them on the registry. Believe it or not, this has happened. I was in a case where, and the kid's now 17, nothing's happened, they've been treated for 2 years, and there's nothing in Delaware except going to a court. A judge has to say, I'm going to take you off that registry. There's something wrong with that. The registry was meant to protect the public. It's not doing it. To give you a false sense of security, and we are identifying a heck of a lot of kids on this registry that are just being stupid.
Mhm.
And they don't have a history of sexual assault, and some of these kids have been victims themselves, and they're reenacting their traumas. And how do we manage that therapeutically? We identify them as registered sex offender, and now they have a hard time with their school and getting in the community. It's a mess. All right. Okay, so bell curve. This is a distribution that happens in nature, and it's just an observation. It just really happens. So if we talk about IQ, the average IQ is 100, and so 68% of the population has an IQ between 85 and 150, whether you like it or not. It's just what it is. So that means it's as rare to have an IQ of 55 as it is to have an IQ of 145. That's what that means. So this curve is helpful when we understand tests. So if we have somebody who was a violent individual and we give some of these tests, we're really saying, well, where are they on this? And can we move them in the direction we want? So this is one of the statistics that we use. There's a phenomenon called junk science, which occurs when people are trying to understand psychological principles, and they say things that kind of make sense, but there's just no empirical evidence for it. Empirical evidence means you've tested it. So junk science can be hard to detect because it does make sense. It just doesn't, it's just not accurate. So how many of you have ever read any articles about spot reducing? For dieting, you know, just get rid of your big belly, yeah. You know that's not possible. The body does not say, I'm just gonna focus on not putting any calories into that belly of yours, I'm gonna shove it somewhere else. It doesn't do that. There's no such thing as spot reducing. But if you Google spot reducing, there will be more ads than you could read in a year. It's all
If it were there, the
false.
doctor would prescribe.
Say again?
If it were there, about the doctor would prescribe.
That's probably true. Feelings versus facts. Feelings are things, a phenomena that makes things better or worse. But the fact is what we want to use in court. The facts, okay? Now, Paul Meehl in 1957 wrote an article that was really against therapists. So this is when psychoanalysis was big, and these analysts were talking about diagnosing and the trajectory of patients' populations and how they're getting better. And Paul Meehl said, it's bunk. Clinical judgment is not as good as empirically derived tools. This is what the insurance company does. Whether you like it or not, if you live past 64, you'll go to 82. That's a statistic. You can take that to the bank. Now, that's because, remember our bell curve? When you look at all human beings in America, some of them go to 62 now. So they're counting infant deaths, kids who get killed in auto accidents, drug overdoses, death. So statistically, if you live past 62 or 63, you jump to 84. He has used this empirically derived tool to predict, and this is very sad because I make wine, the quality of wine. That he has these algorithms that he can use that will predict which grapes will produce better wine than any individual who owns a winery who can taste and say, oh, this is better judgment than doctors make with baby's weight. I mean, it's amazing how this covers everything. But his point was, you may personally be very convinced of something because your gut says this is what it is. But unless you have empirical data to support it, no way. Okay? How well can people detect if you're lying or not? Carry a quarter around. It's a crapshoot. There is some evidence that members of the Secret Service can tell about 60% of the time, and that's high, 60%. But the rest of us, no, you can't. So I've had parents tell me, why didn't you know my kid was lying to you? Because I'm human? I don't know how to answer that. I mean, I don't strap them to, like, you know, an EEG machine or something, and then, you know, we're not doing biofeedback. So there is a difference between a forensic interview and a clinical interview. So the differences are my role with the client. See, when I'm doing a psychological evaluation, I am, in essence, being employed by the client. Joe, I want you to test me, see how I'm doing in A, B, and C. I want to go to college, da, da. When I'm doing a forensic evaluation, I'm being employed, in essence, by the court. The state pays for it, but it's really for the court. It's for a judge. There is presumed neutrality when I'm working for the courts. In other words, when I do tests, I'm not on that person's side. I'm not on the court's side, I'm not on the DFS's side. My job is to try to be as neutral as possible. So I give all this information, and I need to have ways, I'll show you, where I can account for what might be bias on my part. So I have to be able to talk about that. So if somebody said, I think you touched the scale a little bit when you were measuring it, I have to be able to prove that I did not. Similarities are, we still have obligations, ethical guidelines. There's a set of separate ethical guidelines if you do forensic evals, and also reporting of abuse. So DSM is the diagnostic manual that we use. So it's this book that has all of the diagnoses that we use and all of the symptoms you have to have the diagnosis. This is a moving target. And you're going to love this. The way a diagnosis is put in the DSM is by a roll call, a series of votes by the American Psychiatric Association. So they have a meeting, and they say, this is what evidence we have that this is now a legitimate issue. These are the symptoms we think. Everybody who agrees, raise your hand. Everybody disagrees, put your hand down, blah, blah, blah. And that's how they do stuff. So I have copies of old DSMs, 2, 3, 4, 5. And you can see how diagnoses change. When I first practiced in 1984, there was a diagnosis called ego-dystonic homosexuality. This was somebody who was homosexual and didn't like it. That was tossed. There's no such diagnosis like that in DSM now. But that kind of shows you that these mental health diagnoses are not apolitical. They are very much influenced, just like our bodies are, by the environment, the culture, the age. So does the diagnosis need to be given in a forensic eval? It depends on the purpose of it. So I also do child custody evaluations. When I do child custody evaluations, I don't diagnose the parents. When I do forensic evals for court, for DFS, I give a diagnosis. Are they valid and reliable? They move, depending on which DSM you use. So I always try to use the most current version. I love this story. I was testifying one time in Sussex County, and their DSM-4 was out, and I had given a diagnosis, and this attorney, who was really, really sharp, stood up and said, I think you're wrong on your diagnosis. I said, oh. And he was very dramatic. So he's at the podium. The diagnostic manual is like a very large book, but you can get like the small version. I had the small version with me. So he gets up and he slams the big book on the podium for emphasis to show me, and he's going through the book, and I said, what are we looking at? He said, dependent personality disorder, and I could see by the color. I said, oh, I use DSM-4R. It was a newer version. Closed the book, put it down, sat down. I love it. Is there always a relationship between diagnosis and behavior? Yes, because the diagnoses are based on behaviors, but that also shifts a little bit. It may depend on the person's age, that type of thing. So what do I need? I need a review of records. You can't say, Joe, go test this person, and I have no clue why I'm testing them. The reason is, I have a lot of tests in my office. I'm not going to give someone every single test I've got to figure out what's going on. And if I want to be neutral, I can't be the one deciding the question. So if I'm the one deciding the question, I might say, oh, Mr. White's here. I'm not sure I'd like him. I think I'm going to test him for criminality. Because he'll come up positive on something if I do it enough, So I need somebody to kind of tell me, this is where you want to steer your evaluation. These are the questions I want you to address. No more, no less. So those are my marching orders. I don't go beyond that. And if I feel I need to, I call the social worker and the attorney. So sometimes I've done that. I said, I'm not sure I understand this question. What exactly are you looking for, and why are you asking it? Or I might ask the attorney, I don't think this is a fair question. The way it's phrased isn't fair to the client. Let's change it. This has been a moving target. Back in the day, maybe 10 years ago, some of the opposing attorneys, so not the DFS attorney, but were saying, this is too one-sided. Zigaro gets these questions that are really kind of sinking my client. So we want to review all the questions. I don't have a dog in this fight. I don't care. So I said, fine, from now on, have all the questions go through every attorney, you have to sign off on them. You know how long that lasted? 2 weeks. Because the other attorneys didn't want to review every question I was gonna, because it's a lot of work, and they just decided, it's okay. And did you have a question? No, sorry.
Yeah, I did have a question. So, if I'm a DFS worker or a lawyer, how do I know the right question to ask if I'm not trained in? I mean, where do those questions come from? Or how-
That's a good question.
Good
Okay,
question,
so I do trainings for DFS.
Okay.
So I meet with DFS about every 2 years. We have a training like this, and I'll show you some. I've gone to other states, and I say, what questions do you ask? And so we've kind of distilled that down to, here's about 10 or 12 questions that for the most part are addressing what we need to address. The main issue for the families I work with is there an underlying mental health disorder that's not been diagnosed, that needs to be addressed, and this is why they're not finishing their treatment plan. So my job really is to say, let's really make sure we've covered all our bases. So given that, it's a limited amount of questions, 10 to 12 questions. A question that they may or may not ask is like, what's the person's IQ? We think they have a cognitive disability. Can you do, so that's a rare one. Every once in a while I get it. I had one time about, did the person have Asperger's? That's also very rare, but we can do that stuff. So for the most part, it's general questions. Do they have a diagnosis? Will that diagnosis affect parenting? If they have a diagnosis, what treatment should be offered to help them take care of the problems that they're having? I love to review the court hearings because most of the judges write pretty well. And also it tells me what they're thinking of. So I get copies of the review hearings every 3 months. So if I'm going to test someone, I always ask the social worker, make sure I get the most recent court hearing because that tells me what the judge believes. If it's in the judge's review as substantiated, and a lot of the people I work with don't get this, that means that judge believes it. It's not an opinion anymore, it's a fact. So these parents come in and they say, I didn't really do that. So you know what, the judge believes you did. Well, how do you know that? Let me read this to you. The person was substantiated for neglect, for doing da-da-da. They said, they didn't know that meant that that's no longer going to be a discussion. The judge says that happened, okay? Review of correspondence between the social worker and the causes, if you guys have been involved with that. So I ask for as much as I can get. The more information, the better. One of the other criticisms opposing counsels have offered is he gets too much information. And my response to that is, if you were going to your medical doctor, would you want to go in there and say, guess what's wrong with me? You'd say, review my background, You would never do that, so don't ask me to do that. Guess what's wrong with me? I want that back because that's part of their history. And it helps me understand the bigger picture of how did we get where we are, and so therefore what do we need to do to get beyond it. I have standard questions in my clinical interview. I ask about family, education, mental health, etc. I review the DFS records with the client because sometimes there have been 3 or 4 workers involved. And so, like the monks of old, they're repeating mistakes. So social worker A was the first person on the case. They made a little error. They didn't even know it. Well, social worker B just believes what social worker A wrote. Now that error has become a fact. Social worker C also, because of the error from social worker B. So that's the problem here. So what I tell the folks I evaluate is, no secrets. I'm going to show you everything I've got, and I'm going to go through every test I work with you. So you're not going to be surprised in court when I say something, because I want to talk to you now about what I'm thinking. So if I'm in error, we can talk about this. And that's what we do. So we go through the notes, and that's why Carol Davis in particular is an attorney who often will say, did you read the social summary with them and did they agree to it? So we go through, well, the social summary said A, the client said B. Social summary said C, the client said D. I don't have to say anything else about that. The judge is the one that has to make sense of that. I'm not a judge. All I have to do is report. So I don't have any problem just reporting what the person said. And some of it is a little odd, like hard to believe. I don't care. I interviewed a guy one time, And where my office is in Milford, I can see the parking lot. So the guy drove to the appointment, but his driver's license is suspended, at least if what the social worker said is accurate, that's true. So he comes into the office and we're chit-chatting, and these evaluations are long, they're about 3 hours. I like to be friendly with people, respect them. People tell me a lot of stuff, I think because I'm not in their face, I don't take time, I don't take a break. If they smoke, they can have a cigarette, I don't really care, I get them water. So we're chatting, I said, how'd you get here? He said, I drove. He said, your license has been suspended for 15 years. He said, that's right, it has been. I said, now you remember at the beginning of this, I said, don't tell me anything you don't want me to write about because there's no confidentiality. He said, the judge will be fine because that will tell him how safe I am, that I've not gotten caught. I'm sorry, I've not gotten caught for 15 years. I testified to that. I thought Millman was going to break his neck. But that's what the guy said, and that's what I reported. So again, I always review the results with the client. The other thing is, remember, tests are not infallible. So I may have gotten a certain response on a test that the client's saying, that's not me. So an example is, last week I did the evaluation of someone, and they scored in such a way that you would think they had schizophrenia, some type of thought disorder. But I had already been with this person 3 hours, and I couldn't detect any thought disorder, delusion, none of that. So something else is going on. As she and I talked about and went through, she has such anxiety that it interferes with her thinking process, her ability to focus and concentrate. Some of the smaller symptoms of schizophrenia, which is what she was indicating on the test. But because that wasn't what my gut was saying about her, I didn't observe it, and she was saying